Okay, so today we're going to talk about mental disorders. Let's talk about mental wellness and mental illness. So mental wellness is the capacity to cope and adjust to the ongoing stresses of everyday life. It's a relative state of mind. Mental illness, on the other hand, is when you have difficulty coping with ongoing everyday stresses, which result in psychological pain and possibly affects physical health. So sometimes stress can be a good thing. It gets us off our butt and gets us to do something. Your child falls down, and that rush of adrenaline gets you to get them to the hospital to get treated. But this chronic stress is a bad thing. Mental disorders could be caused by heredity, congenital factors, accident, trauma, drug toxicity, stress, or psychotic disorders. Mental disorders are loosely classified as maladaptive disorders, phobias, anxiety, depression, or addiction. All right, let's talk about mental retardation. This is subnormal intellectual development as a result of congenital causes, brain injury, or disease. This is any condition that compromises the blood supply to the brain. It's characterized by any of various cognitive deficiencies, including impaired learning, social, and vocational ability. This is a developmental disability, and the onset must be before 18 years of age. In learning disorders, these are also also known as learning difficulties or learning disabilities, conditions that cause children to learn in a manner that is not normal. The brain's ability to receive and process information is affected. Performance on standardized tests is lower than expected for the age, schooling, and intelligence level. Okay, now these are communication disorders. We're going to talk about stuttering. The communication disorders are also known as phonological disorders. The frequent repetition or prolongations of sounds or syllables. Stuttering appears to run in families and is more frequently seen in males. Anxiety appears to be a major factor that creates and maintains the behavior, and it usually occurs between 2 to 7 years of age. When I was in grammar school, probably about 7th grade, I had a problem with stuttering, but I just couldn't say anything. It's like my brain was telling me what to say, but nothing would come out, and would be like So I grew out of it. Obviously, I'm talking and I can't shut up, so everything worked out well. Pervasive development disorder. This indicates a severe impairment in several areas of development, including communication and social interaction skills. There's a lack of nonverbal communication and the inability to show emotion. Now, a pervasive development disorder is Autistic disorder. This is a syndrome of extreme withdrawal and obsessive behavior. It has its onset in infancy and becomes evident in the 2nd or 3rd year. Known to be highly heritable. According to Dr. Andrew Aidsman, children should be screened for autism at 18 and 24 months of age. Some of the symptoms. There's a marked impairment in nonverbal communication, absent or delayed verbal communication, inability to initiate conversation, does not initiate age-appropriate play, repetitive motions, inflexibility towards change, failure to establish normal peer relationships. And 4 symptoms are nearly always present: social isolation, cognitive impairment, language deficits, and repetitive naturalistic motions. They have an aversion to physical contact or cuddling, and these can also be a sign. All right, let's talk about ADHD, Attention Deficit Hyperactivity Disorder. This is a condition of persistent inattention leading to hyperactivity and impulsivity. 3 subtypes of ADHD. There's a combined type that has inattention and hyperactivity, a predominantly inattentive or a predominantly hyperactive impulsive. In ADHD, the brain areas that control attention use less glucose, indicating that they are less active. Decreased activity in the brain may cause inattention and other ADHD symptoms. Oppositional Defiant Disorder, a behavior disorder in which children demonstrate behaviors that are oppositional towards adults. The presence of ODD is a strong predictor of poor outcomes such as early substance abuse, school dropout, major depression, poor peer relations, and delinquency. There are 4 main causes: a negative child temperament and ADHD, negative parent temperament, and that means you got a bad child and the parent's not doing anything about it, ineffective child management, and parent and family stress events. Tic disorders. These are sudden recurrent motor movements such as facial grimacing, coughing, eye blinking, or vocalizations such as repetition of one's own words, using words out of context, or in a socially unacceptable manner. We have Tourette's is an example of a tic disorder. Consists of multiple motor tics coupled with 1 or more vocal tics, which can appear simultaneously or at different times, also known as Guillain de la Tourette syndrome. All right, dementia. This is a progressive deterioration of mental faculties that causes cognitive decline, such as perceiving, thinking, and remembering. Irreversible brain damage may be the result of a compromised blood flow to the brain caused by plaque in the arteries such as atherosclerosis, a blood clot, which is a thrombus, or trauma. Okay, now these are some different types of dementia. Alzheimer's disease, just FYI, in 1906 it was named after Dr. Alois Alzheimer, and he was German. This is a progressive degenerative disease of the brain that causes a gradual loss of mental and physical functioning. It is the most common cause of dementia and occurs more frequently in adults over 65 years of age. The incidence increases in people older than 80. Let's see, early symptoms. There's a loss of short-term memory, the inability to concentrate, and incapacity to learn new information, impairment of reasoning, and subtle changes in personality. Now, in a mild decline, you see memory lapses, and in severe decline, patients lose their capacity for recognizable speech. They have the inability to walk without assistance or sit without support. Now, contributing factors to the degradation in Alzheimer's, you have amyloid plaques, okay? Now, this beta amyloid in a healthy brain, these protein fragments are broken down and eliminated. In Alzheimer's, they form hard, insoluble plaques. And the other thing is you'll have neurofibrillary tangles. And these are made of tau protein. Normally, tau protein stabilizes internal support structure of neurons. In Alzheimer's disease, the tau protein becomes entangled, killing the neuron by damaging critical parts of the support system. Okay. Also, there's no cure for Alzheimer's, but Aricept can be prescribed to control cognitive decline, anxiety, depression, and delusions. Now, vascular dementia, a reduction in blood flow to the brain from narrowed or sclerosed arteries that can result in reduced oxygen and nourishment to the brain cells and cause a general loss of intellectual abilities. Some causes of vascular dementia are atherosclerotic plaque grows in the carotid and cerebral arteries, reducing blood flow to the brain, and this is ischemia. This starves the brain for needed oxygen. Brain cells die, impairing cognitive function. And we have dementia caused by head trauma. A traumatic insult to the head may reduce blood flow to the brain and result in dementia. Type of head injuries that could reduce blood flow include open and closed head injuries. Now, a closed head injury is a hard blow to the head from striking an object, but the object did not break the skull. And an open head injury is when the patient was hit with an object that breaks the skull and enters the brain, going through the windshield in a car accident or a gunshot wound to the head. The open head injury is also known as a penetrating head injury. And you could also have hematomas, which are localized swellings filled with blood resulting from a break in a blood vessel or a skull fracture. All right, now we're going to talk about schizophrenia. This is any of a group of psychotic disorders usually characterized by withdrawal from reality, illogical patterns of thinking, delusions and hallucinations, and accompanied in varying degrees by other emotional, behavioral, or intellectual disturbances. Schizophrenia is now thought to be caused by a poor signaling by the neurotransmitter glutamate, specifically the NMDA receptor, which is the N-methyl D aspartate. This receptor is compromised. So you either get increased dopamine or decreased glutamate, and that's the normal, and this is dysregulated in schizophrenia, which means it doesn't work the way it should. Okay? Schizophrenia is classified in two ways, positive and negative manifestations. So a positive manifestation is an excess or distortion of normal functioning. And we're going to give you some examples of that a little bit later. And a negative manifestation is a loss of normal functioning. Okay, and this is just talking about schizophrenia. Okay. Now, in the treatment for schizophrenia, the acute phase, they'll have atypical antipsychotic drugs such as risperidone, Zyprexa, Geodin, Seroquel. Long-term multidimensional treatment combines supportive psychotherapy, drugs, and family involvement. Okay. Now, these atypical antipsychotics, these are called neuroleptic drugs, and these are tranquilizing drugs that work by reducing nerve activity. The potential side effects of the neuroleptic agents used to treat schizophrenia are known as extrapyramidal side effects. ESPs are a set of movement disorders that can occur with drugs that affect dopamine levels. Okay, so you have the pyramidal system, and this is a direct activation pathway for the voluntary movement. So this controls motor impulses. The extrapyramidal system is a secondary system for control of movements, and it's an indirect activation pathway. Now we're going to talk about mood disorders. The first one is bipolar. This is a major affective disorder with abnormally intense mood swings from a hyperactive or manic state to a depressive syndrome. And the other mood disorder that we're going to talk about is major depressive disorder. This is a mood disorder characterized by one or more serious depressive episodes that include deep and persistent sadness, despair, and hopelessness.